Hi, everyone. My name is Bhumi Khambholja, and I'm a project manager with Wisconsin Health Literacy, which is a nonprofit organization that works to improve both personal and organizational health literacy. I'll be talking about the Medication Label Initiative, which we are working on in conjunction with our academic partner at the Medical College of Wisconsin, Dr. Kenneth Shell-Hayes. Prescription medication labels are often the most accessible resource for patients to find information about their prescription medications and how to take them. However, it's often difficult to find or understand important information on them, such as the directions for use. Traditional medication directions require interpretation, and although anyone can misinterpret medication directions, patients with lower health literacy or complex drug regimens are more likely to do this. The purpose of this initiative is to improve medication labels for patients. The United States Pharmacopoeia, or USP, is a drug standards organization. They have developed medication label standards using health literacy best practices so that labels are more patient-centered. Although there is evidence that patient-centered labels help people find and use information on them, they have not been widely adopted. So another goal of this project is to establish the best way to improve adoption. Here in Figure 1, you can see a prescription label that does not follow USP guidelines, and Figure 2 is a label that does. The USP guidelines include the most important information for patients being at the top and improving readability by using larger font and more white space. The project was conducted in phases. Phase 1 was a feasibility study, which involved semi-structured interviews with key stakeholders. Phase 2 was a pilot project where new labels were implemented in a small number of independent and outpatient hospital pharmacies. And Phase 3 was expanded adoption of patient-centered labels across Wisconsin. It was important to learn about patients' needs and preferences in this project. This was done through surveys, focus groups, and patient participation on an advisory group. These activities provided valuable information that could be shared with pharmacies. It was also important to make sure pharmacists were supportive of the change, and this was assessed through survey. Participation was kept strictly voluntary to provide pharmacies the flexibility needed to make changes. We are currently in Phase 4 of the project, where we are working with prescribers and health systems to improve the use of clear prescription directions. Specifically, we're working to improve the use of universal medication schedule directions, which include explicit timings such as morning, noon, evening, and bedtime. Partnerships were also formed between community, medical, academic, pharmacy, and health IT organizations. Leaders in these areas participated and continue to participate on the Project Advisory Council, as well as communicate the benefits of this change for patients to their network. The survey of pharmacy staff showed that 84% favored adoption of USP standards. At the end of Phase 3, 245 pharmacies adopted label standards, and this is about 21% of pharmacies in Wisconsin that are mainly independent, small chain, or hospital outpatient pharmacies. 93% of patients reported that they found labels confusing to read or understand at least some of the time. 88% preferred a label that followed the USP standards. During focus groups, patients were also able to design their own label. And what was found is that the labels they designed followed USP guidelines. You can see a picture of one of the focus groups here. Analysis of Medicaid data at one pharmacy organization showed improved adherence in 3 classes of medications after the label change. Adherence was calculated using what's called the medication possession ratio and categorized into being either low, medium, or high. These graphs here show the adherence categories for blood pressure control and asthma control medications. The blue bar represents the percentage of people in each category before the label change. The orange bar represents the percentage of people in each category after the label change. If you compare the bars, you can see here that after the label change, patients moved from the low and medium adherence categories to the high adherence category. In conclusion, this initiative shows that patients prefer labels that follow USP standards and indicates they are better able to find and use information on them. Demonstrating the needs of patients to stakeholders was a driver for change. It was also important to get the support of different stakeholders and keep participation voluntary. As I mentioned earlier, we are currently in phase 4 of the project to improve adoption of universal medication schedule directions, which have been shown to improve patient understanding on when to take their medication, help simplify drug regimens, and also have been associated with improved adherence. I've covered a lot of information in a short amount of time, so please feel free to email me with any questions, and my email is listed here. Thank you for listening.